My name is Evgenia Sanudakis and I'll be demonstrating a hold relax PNF for increased right rotation using the right rotatores in the lumbar spine. The assessment findings that would lead me to do this technique are a lack of range of motion towards right rotation in the lumbar spine. So is it okay if I palpate you today?
Yeah.
I'm going to need you to have your hands on your shoulders. I will palpate from L1 to L5 and I'll have you go into right rotation. And from doing this, I'll see at which vertebrae the lack of rotation is coming from, or if it's coming from a segment. And then I'll have you lie on your stomach. So now we're going to be doing an oscillatory technique, which is a general mobilization of the lumbar spine to see at what level or levels of the vertebrae there's a problem. So as I'm pushing, I need to feel the vertebrae moving in the same direction. I'll be performing the PNF hold relax for the rotatores in the lumbar spine to increase right rotation. So I have my patient lying on their left side with their right side up, close to the edge of the table near me. Both knees are bent with her foot hooked under her calf, and her elbow is going to be here. So with my right forearm, I'll be pushing to rotate the torso towards the right, and with my left forearm, I'll be pushing the pelvis more anterior. With my hands here, with my right hand, I'll be pulling downwards, and with my left hand, I'll be pulling upwards. As soon as I feel my first restrictive barrier, I will stop, and I'll have my patient contract using 20% of her force for 6 seconds, and then relax for 2 seconds, and then we are going to find the next barrier by pushing a bit further on both sides, so for the torso and the pelvis, and then we'll be holding 12 seconds and restarting this until there's no new range of motion that's gained for 3 to 5 times. The first exercise for increased range of motion at the pelvis will be a self-mobilization for the SI joint. So for this, the patient will be side lying with their hip and knee at 90-90, with their tibia parallel to the foam roller, and she'll be rolling out. This exercise is indicated if there's a hypomobility at the SI joint when testing joint play, either centralized PA or a PA on either side of the SI joint. And we'll be doing 3 sets of 12 on each side to increase mobility of the SI joint. The first exercise helped to gain mobility at the SI joint, and now we'll be using this new mobility to gain more range of motion at the pelvis, doing ABCs on the Swiss ball. So I want you to do this exercise, do the full alphabet 2 times per day, and this is a good proprioceptive exercise as well because it gets the mind and body working together.